Sometimes it's okay if the only thing you did today was breathe. Cystic fibrosis is a progressive disease that results from inheritance of a recessive gene on chromosome 7. This gene is called CFTR and results in the lack of a certain protein that thins secretions by controlling the movement of sodium into and out of cells. This leads to thickened secretions in the respiratory and GI tract.
Miss Amy, please tell me about your symptoms.
I have frothy stools. Every time I cough, my stools come out. And I have a phlegm cough, and I wanted to bring it to show you. Sometimes it has blood in it too. My stomach hurts really bad.
I'm sorry. I want to go ahead and take your vitals.
The earliest signs of CF are meconium ileus and a taste of salt when the child is kissed. When this disease was first documented, they called these patients children of the sea. Other signs and symptoms include a persistent cough that produces thick sputum, wheezing, breathlessness, exercise intolerance, repeated lung infections, inflamed nasal passages or a stuffy nose, foul-smelling, greasy stools or steatorrhea, poor weight gain and growth, intestinal blockage, blockage of the pancreatic duct, and severe constipation.
And we're going to go discuss a nursing care plan for you.
Okay.
Okay, is there anything else we can get you? Would you like some water, ice chips?
No, I think I'm okay.
Okay, here's your call light. If you need anything, just press that button.
Okay, thank you.
Nurse Michaela, let's discuss the care plan of this 7-year-old female.
Let's do that, Nurse Janelle. Our nursing diagnosis is ineffective airway clearance related to cystic fibrosis, as evidenced by inability to clear thick mucus secretions. How is that, Nurse Janelle?
That sounds great, Miss Michaela. Nurse Michaela,
Yes, Miss Nurse Janelle.
let's discuss the short-term goals for this patient.
Let's do.
The patient should demonstrate effective coughing technique within 48 hours of hospitalization and maintain oxygen saturation of greater than or equal to 95% during hospitalization. How does that sound, Nurse Michaela?
That sounds great, Nurse Janelle.
Outstanding. For a long-term goal, the patient will be able to report a decrease in
Dyspnea.
during normal activities by discharge.
We will now go over the interventions.
Let's.
Provide moistened oxygen and aerosol therapy 3 to 4 times a day. Frequent oral care. Perform respiratory hygiene such as breathing treatments and deep suctioning of shortness of breath. Perform chest physiotherapy every 4 hours and teach effective coughing technique. How does that sound, Nurse Janelle?
That sounds outstanding.
Hi, Miss Amy. How are you feeling?
I'm feeling better.
Good. I see you have your IV line started. That's great. You have your vest on for chest physiotherapy.
Yes,
Great. And how does that fit?
feels like a good fit.
Okay, great. And looks like we're going to go ahead and start an albuterol treatment for you.
Okay, great.
Get your chest moving along.
There is currently no cure for cystic fibrosis. The goal of treatment is to prevent and control lung infections, loosen and remove mucus from the lungs, and prevent and treat intestinal blockage. Mucolytics are important to help patients expectorate mucus easier. Antibiotics are often needed to fight infection or prevent it, as even the slightest infection, such as albuterol, are also important in opening airways. In regards to the GI effects of this disease, patients take pancreatic enzymes with meals and snacks to help digest fat. Eventually, a lung and heart transplant may be necessary for these patients.
Hi, Miss Amy. How do you feel?
I feel better.
Good. You look great.
Thank you.
Let's take off this equipment.
Most children with cystic fibrosis stay in good health until they reach adulthood. They are able to take part in most activities and attend school. This, however, varies case by case. Lung disease eventually worsens to the point where the person is disabled. Today, the average lifespan for people with cystic fibrosis who live to adulthood is about 37 years. Death is most often caused by lung complications.
Amy, I feel better.
Great.
I'm not coughing anywhere with poop coming out my butt, and my stomach feels better. I don't have a lot of mucus with blood. So
Good,
much
I am
better.
so glad you look really good.
Thank
Your
you.
skin looks great.
Thank you.
No pale.
Oh,
Yeah, you look really
you
good.
guys are a great team.
Love your pigtails, by the way.
Thank you.
Goal met. Patient is able to demonstrate effective coughing technique, is maintaining O2 saturation above 95%, and is able to report a decrease in
Dyspnea.
during normal activities.
I'm Kelsey, and I'm taking a breath for cystic fibrosis.
I'm Janelle, and I'm taking a breath for cystic fibrosis.
I'm Amy, and I'm taking a breath for cystic fibrosis.
And I'm Michaela, and I'm taking a breath for cystic fibrosis.
Let's
all take a breath for cystic fibrosis.
I feel better.
When I cough, my poop comes out of my butt. Just explodes. Wait.
Miss Amy, we're gonna leave you for
Clear, thick mucus secretions. Let's do that.
Should include the patient able to report a decrease in dyspnea. Keep going.
Oh my god, I have an idea.
Should be that the patient will be able to report a decrease in
Dyspnea. Can we start that over?
Oh wait, what am I?
That would be a total blooper.
Boom. Boom. Oh, okay, cool. We got this back on. We're good. I feel better.
It's okay. Stop it.